Hello again, this is Susan Knowles. Welcome to Module 3. This is teaching and learning as it is applied to clinical nursing education. The goal of this module is for you to have an overall understanding of learning preferences and teaching concepts and to be able to apply learning theories to your practice. In this module, we'll talk about 3 different learning theories. There are lots of them, but we're just going to concentrate on 3 of them. We're going to talk about adult learning theory, Constructivism, and reflection or reflective practice. When you finish this module, you want to be able to explain the assumptions of the adult learning theory. You should be able to state your own personal preference of learning style based on the results of your VARK. You should be able to give examples of how being aware of your own personal learning style could benefit teaching students. You'll be able to discuss your own DISC results with your mentor and compare their results with your results, and finally discuss your personal experience using reflection and how this strategy could be applied to your own teaching strategies with students. The NLN core competency that is the most obvious with this module is number 2. And it states that nurse educators recognize their responsibility for helping students develop as nurses and integrate the values and behaviors expected of those who fulfill that role. And specifically, the task statements are that we will identify individual learning styles, provide resources to diverse learners to help them meet their individual learning needs, create learning environments that are focused on socialization to the role of nurse, and facilitate learners' self-reflection and personal goal setting to foster the cognitive, psychomotor, and affective development of learners, and finally to recognize the influence of teaching styles and interpersonal interactions on learner outcomes. Here are your discussion questions for this module. Please, after taking both of the assessments, the DISC and the VARK, keep those results so that you can discuss those with your mentor. And I hope you'll be able to take that and see how you can apply it to your own teaching and learning style, and how can that be applied to teaching students. The agenda for this module is the same as the others. However, in this module you will be going out to the internet and completing some learning activities and then bringing back those results to finish out the module and to discuss them with your mentor. The assignments for this module are a little different. You'll need to access the internet for 2 activities during the module. But before doing them, there will be some video explanations. Additionally, please read the one article by Marcy on learning styles. This article is written by a physician assistant, and she's talking about using both adult learning theory and the VARK assessment tool in teaching physician assistant students. So I'd like you to read that article and see what your thoughts are in using it with nursing students. Here are some additional readings that you can do to give you a deeper understanding of the discussions within this module. Learning is acquiring new knowledge, and it's lifelong. And most importantly, it causes a change in either our mental processing or our emotional functioning. When we learn something, it changes our thoughts and actions. Learning depends on our motivation and it's a very individual matter of perceiving and processing information. The learner, not the teacher, is the single most important person in the educational process. During the learning process, the teacher can have a critical influence on learning through role modeling. The educator is vital in giving support, encouragement, and direction, as well as feedback, reinforcing learning, and then evaluating the learner's ability. In a moment, I'll be discussing some learning theories. Learning theories can give us a framework from which we can see how students learn and actually prefer to learn. In this module, I'm going to review adult learning, Constructivism, and reflection. The adult learning theory is based on the belief that adults and children learn differently. The assumptions of this theoretical model are that adults are self-directed and bring life experience to their learning. Additionally, adults are goal-oriented and must see the relevance of the information they are expected to learn, as well as its applicability. How often have we heard that? So why do I need to know this? Most importantly, adults must feel respected in the educational relationship. This model recommends preparing the learner as a first step, which is why giving clear explanations for the rotation and each clinical day is so important. The great thing about the clinical experience is that students can actually see the relevance of why they are there. It becomes very important to bridge the classroom with the clinical experience to strengthen this relationship, the didactic to clinical. Extending mutual respect is very important to the adult learner, and this can be demonstrated through a collegial relationship, helping the student to see that you as the instructor is still a learner. Students often think that we know it all. Novice instructors often think that they should know it all. And I want to assure you that we all know that that's not true. And it's okay to let students know that you don't know the answer, because your role is as a role model. You can admit that you don't know the answer. And if you don't know the answer, you say, let's look it up. Not necessarily you go look it up. You say, let's look it up. Because now you're demonstrating appropriate professional behavior. That is, that if you don't know something, you look it up. We know as experienced nurses that we know much more than most novice students. But we can never know it all. I've attached the article by Johns to the module for you to read for a deeper understanding of his work based on Carper's fundamental ways of knowing in relationship to reflective learning. It's very interesting, and it gives you a little more insight into how we actually do learn from our reflection upon patient care experiences. I'm sure that we're all aware of this style of learning, and it is incorporated into this course for that very reason. Basically, it's a learning through the lived experience. According to Johns, it's our actual experience in caring for patients and then contrasting it with the desired practice. In Table 1 of this article, John lists some guided questions or clues that you can use as well as students can use, or you can assign for students in their reflective journaling. Also attached to this module are the articles from the faculty at Oregon Health Sciences, Tanner's Guide for Reflection, and Lassiter's Rubric for Clinical Judgment. These tools and articles can also be found in the Clinical Toolbox. I talk more about them there. Lassiter's Rubric can help to more objectively judge a student's reflective thinking without judging the student's writing product. When a student writes in their journal, it needs to be judged only on how they are thinking, not on their technical skills of writing. Reading these articles will help to give you a sense of the usefulness of reflective journaling. Going back to John's article, some of the clue questions that he talks about are things like, what was I trying to achieve? How did I feel in the situation? How did my actions match with my beliefs? What knowledge did or should have informed me? And then how does this connect with previous experiences? Could I have handled this better in similar circumstances? Has this changed my way of knowing? These are some interesting questions, and sometimes this is difficult for students to do. Sometimes they don't want to do it, and I know as a student sometimes I didn't want to do it, because you really have to reach deep inside and start thinking. But through this work, we really do learn. Constructivism is a theory that learning occurs when the learner can make connections between new material or experiences and previously learned material. This type of learning promotes collaboration and the students' participation in their own learning. This theory is a learning model that empowers students to learn through their own classroom guided experiences, or in this case in the clinical guided experiences, and reflect upon these experiences. So it ties in to reflection and practice. In the following video, John Abbott discusses a theory of constructivism. I think it's important in the sense that each of our students comes to the educational process already knowing something. And it's important to tell our students that it's all right to build upon what they already know. They don't have to throw everything out and start over again. And I've seen this where students don't trust what they already know. I've seen this when I teach medication math calculations. Students come to class with math skills, which they will build upon to learn to do the medication calculations. I've also attached a handout from the conference that I attended last fall in St. Louis of the Associate Degree Nursing. The instructors there held a breakout session where they talked about this learning theory, so that's why I thought it would be important to put it into the course. The handout is called Deconstructing Constructivism. And they have some learning activities listed on this handout which you could consider using in your clinical rotation. Case studies, which are always good in class or in the clinical area, could be discussed in a post-conference. Students can be paired for an activity and then they can share what they have learned. And of course, simulation is definitely an example of using this particular learning theory. And just like you're building upon your own past experience as a nursing student and hopefully as either a preceptor or with working with students in your own clinical site. The VARK is a guide to learning styles. It's a short, simple, and quick online questionnaire with a practical application to better understand your own learning preferences. The purpose of including this tool is to help you understand the similarities and differences between how you and your students learn best based upon their preferences. The VARK is based on the following learning domain preferences. And VARK stands for visual, oral, which is listening, read, write, kinesthetic, or hands-on activities, and multimodal. Dr. Fleming, who developed this questionnaire, I've included his videos, so he'll explain them in his own words in the following videos. After listening to the video by John Abbott where he discusses a theory of constructivism, please view the 3 videos by Dr. Fleming to get a better understanding of the VARK. Through these videos, he will discuss the VARK, what it means, the different styles of learning, and how you can use this tool to assess your own learning preferences and your students. By using this very quick and easy tool, we as instructors can get a better understanding of how we learn and to appreciate that each individual has their own preference. That doesn't mean that someone can't learn if the material is presented in a manner that is not their preference. It just means that it's easier to learn if it's presented in a way that we prefer And this is why it's so important to use different methods of instruction. Show and tell, discussion like at post-conferences, hands-on like in the skills lab, and writing like in journaling about their clinical experience. Now it's your turn. When you click on the URL, you will be taken to the VARK questionnaire. Remember that it's short, simple, and quick, and it's completed online. Once you have finished taking the VARK, you'll get your results right away, and then you can discuss those with your mentor. To better understand yourself and others, specifically students, and how to interact with them, the DISC is an easy self-assessment tool. You can quickly take this online personality questionnaire, which really just assesses behavior, and it's hoped that by better understanding yourself and possibly seeing how others behave, you'll be able to better shape your own behavior to work better with students. Students find instructors that can express their expectations clearly to be the most effective instructors. Therefore, it's hoped that by better understanding yourself, you can do this. There's a video that follows this slide which will give you a quick explanation of the DISC. On this slide, you'll see the highlighted Take the Test, and you can go ahead and click that and go ahead and take the test, and then you can learn more about the DISC. You should have already taken the free DISC personality test, but what I wanted to share with you are a couple of videos that are kind of comical, where Dr. Rome describes the differences in personality of people based on understanding the DISC. Here are some additional website resources for you on the educational theories that we talked about in this module. Please complete the evaluation after speaking with your mentor, and as usual, the references for this module are following the evaluation. Thank you for joining me on this module.